The human papilloma virus is a causative organism for cervical cancer. Now, this is usually gotten through sexual contact, and usually women with multiple sexual partners are believed to be more at risk of having HPV virus, which is a causative organism for cervical cancer. So in this video, we're going to be talking about signs and symptoms of cervical cancer, ways to diagnose cervical cancer, ways to prevent cervical cancer, and who is most at risk of having cervical cancer. So if this sounds like something that you would love to know, then continue watching this video. If this is your first time on this channel, kindly hit the subscribe button, turn on notification so you continue to get updates when there's a new video. And for my returning subscribers, thank you for coming by. Please give the video a like as we continue through it, as that is going to help it get more visibility. Now, cervical cancer is more popular than it used to be. Now, more women are getting diagnosed with cervical cancer. Women on antiretroviral therapy are also believed to be more at risk of having cervical cancer as well. Now, we're going to be looking at some of the earliest signs of cervical cancer that every woman should look out for. Whether you have multiple sexual partners, whether you've never had a sexual partner all your life, or if you have just one sexual partner, you need to understand this to make sure you are safe. And number one is bleeding in between period. Now, if you notice that you are bleeding in between period, then you need to talk to your gynecologist. Now, every woman is meant to have a period once in a cycle. I'm not saying once in a month, because depending on your cycle, you could have your period twice in a month, but you're meant to have period once in your cycle. But if you notice that you're now bleeding in between your cycle, you've had your period, but all of a sudden you're still seeing blood, it is a red flag. Report to your healthcare provider for test and intervention. Number two is pain during sexual contact. If you notice that you now feel severe pain during sexual contact, which is meant to be pleasurable, then you need to talk to your gynecologist, talk to your healthcare provider. It can be a sign of something else, because there are several reasons you could get pain during sex, like infection, and it could be a sign of cervical cancer. So report to your healthcare provider for adequate treatment. Number three is bleeding during or after sex. If you notice that you bleed during or after sex, even with proper arousal, with good lubrication, report it to your healthcare provider immediately for intervention. Like I said before, it can be a sign of something else, and it could be that it's early sign of cervical cancer. Number four is change in your menstrual cycle. If you notice that your period is now very heavy and lasting for a longer period of time, it is a red flag, something that you should report to your healthcare provider immediately. Number five is pelvic pain. If you notice that you've been having constant pelvic pain, pain that is unresolving, this is something that you should report to your healthcare provider. It just be a sign of an infection, and it could be a sign of something more complicated. So make sure that you report to your healthcare provider so that test is done and treatment is given to you. Now, when we talk about pelvic pain, is the lower back or lower abdominal pain. So if you're having this pain consistently without it resolving, please go for proper test and treatment. Number six is a change in your vaginal discharge. If you notice that all of a sudden your vaginal discharge is so much, like it is much than you used to have, and then it is accompanied with foul odor, fishy odor, all kinds of odor that you yourself do not understand, you need to report to your healthcare provider. It could just be an infection, and then culture is done, treatment is given, and it could be a sign of something more complicated, like CA service. So report to your healthcare provider immediately you notice all of this kind of change. Number seventh one is vaginal bleeding after menopause. Now, usually menopause is meant to be the time where you do not see your period anymore. So if you have approached menopause, your period have ceased, and all of a sudden you notice that you are now bleeding again, then you need to report to your gynecologist or your healthcare provider. It is one of the early signs of cervical cancer. So as a postmenopausal woman, you're not meant to bleed, so that should be a red flag for you. Report it for treatment immediately. These are the 7 early signs of cervical cancer, and these can be signs of other health conditions. So make sure that you report to your healthcare provider and you are tested so that the exact cause of your symptoms are known, and then treatment is given to you. Let's talk about ways to diagnose and also prevent cervical cancer. Now, these two are kind of intertwined. Now, the first way to diagnose cervical cancer is to do a pap smear. This is one of the major ways to prevent cervical cancer. Doing a pap smear regularly or once in a while as a woman is not out of place at all. If you have the means, make sure that you do it from time to time. Somebody wrote that she decided to give herself a birthday gift of a pap smear, and so she did a pap smear to make sure that she's free of cervical cancer. You can decide to do that. Maybe for your 2023 birthday, go and get a pap smear done as a woman. Is very, very important. Another thing that you should do is, once the result of your pap smear is out, you need to follow it up. If the result is abnormal in any way, don't relax. The problem most women get is that they get the result and they just sit on it without taking action. Once you see the result, proceed immediately for treatment and make sure you follow through with your treatment to a logical conclusion. Make sure, and once that is done, you are sure that you're free of cervical cancer. But if you do not do that and you decide to just sit on the result, it will continue to progress. And know that once cancer spread, it is very, very difficult to treat it, because it is going to spread to affect vital organs, which is going to make treatment very, very difficult. So make sure that you follow up any abnormal results you get from your pap smear. And then the other thing that you need to do is maintain proper vulval hygiene, because by doing this, it will prevent infections from gaining access into your reproductive area. So proper vulval hygiene is also a way of keeping yourself free from infections generally, and also it will reduce your chances of cervical cancer, because the HPV virus is transmitted during sexual contact. One of the other ways to actually prevent cervical cancer is to make sure that you practice safe sex. Once you're practicing safe sex, you reduce your chances of having cervical cancer. So, and when we talk about safe sex, it has to do with you wearing a condom, because condom will not only prevent pregnancy, it's going to prevent spread of STDs and STIs, and also the HPV virus as well will be prevented from spreading to you when you use a condom. And also maintaining a regular sex partner. If it is your husband, stick with him. Avoid sleeping around and then sleeping with different men. That is going to reduce your chances of having the HPV infection and also cervical cancer. Now, when we talk about risk factors, those that are more at risk of having cervical cancer, the number one is those that have multiple sex partners. So women with multiple sex partners are going to be more at risk compared to women that have just a single sex partner, or those that do not have sex partners at all. And also women on antiretroviral therapy. Recently, regular cervical screening have been introduced for women who are on antiretroviral therapies. So these women are more at risk of having cervical cancer, and that is why this screening has been introduced for them. These are some of the people that are more at risk for having cervical cancer. But as long as you are a woman, you are also at risk of having cervical cancer. So make sure that you check from time to time for early diagnosis, if at all there's anything there, and also treatment, so that complications will be prevented as much as possible. Thank you so much for watching this video. If you found value in this video, then please share so others can learn from it. And please hit the like button if you've not done so already. Subscribe also if you have not subscribed at this point. Thank you for watching. See you again in the next video. Bye.